Hello. Hello and good evening all honorable doctors. So we had taken a first COVID session last year, and now we are taking it again for the second wave. Right? My screen is okay, IT.
Yes, okay.
So how is it going? Please move this window away from this panel.
You need to remove background app.
Okay.
Please close background application if any.
Yeah, I've closed. I close it. Okay, fine. So welcome and good evening, all respected honorable doctors, all great homeopaths across India. And it will be the great session today for how to manage second wave, right? So me and Dr. Shakil Mulani, we both will be sharing our experience, how we have managed our patients in second wave, what are the important points, what are the important cases, what are the clinical learnings for us. And I will show you that it will be the great learning for you also. It will be interesting for all of us, right? Along with that, mm, Dr. Shakil Mulani is one of my good friend, uh, in homeopathic field. We met in other song during FCH in fellowship in advanced homeopathy. Since then, he and me came together for discussions, and we had a very good time with Mumbai, and he has been practicing since last many years in Jogeshwari West. One of the most important point about Dr. Shakil is that he's very keen and expert in handling all kinds of deep pathological cases. So daily he used to see almost more than 70 to 80 patients, and along with that 70 to 80%, he has handling almost 50 cases of deep pathological cases like gangrene, cancers. I have been seeing his most of the good cases. He has a fantastic results. He has a very deep knowledge. So today he will be addressing us regarding the second wave of COVID. So in content, we will see about one case of Dr. Shakil Mulani, and then again I will come to you for sharing my understanding of in second wave about investigations, importance of investigation, some pathological, importance, how to take a pathological rubrics, why not this, why this. We will be, go like this way, and we have very short case. Okay, so into that short case, what is the most important point to see in second wave? Okay, so for in pandemic you will get all common symptoms, but how to look into the peculiars, how to look into the very peculiar symptoms that we are going to see, right? So welcome you all, and I would like to invite Dr. Shakil sir, my dear friend, and love to invite you to start your session. I'm going to stop my sharing. Dr. Shakil,
Yes, sir.
yeah,
Thank
please
you.
go
Thank you
ahead.
so much. Is it okay, Dr. Pravin? My screen?
Yeah, just a minute. I will let you know. We will be also having a question answer session at the end of each case. Yes, we can start.
Okay. So good evening, everybody. As Dr. Pravin said, we met in fellowship in the Other Song Academy. He too is an excellent homeopath and a clinician. It's a very rare thing to see a clinician in homeopathy. The people who can deal with pathology should have excellent knowledge, excellent upper hand on clinical practice and clinical knowledge. So even Dr. Pravin is an excellent human being, as well as a good homeopath and as well as a good clinician, a good friend of mine. So we'll start with the first slide. The art of knowing is knowing what to ignore. This became a learning. This COVID session became a learning to deal with pathological cases. So I'll start with my first small short case. So doctor doctor said he will share cases from second wave. Second wave for me it was bit easier, like normal cold, cough, fever. So I told Dr. Pravin that from last pandemic, the first one I'll share two of my cases. The first one is she's my old patient. She used to come to me for hypertension, Mrs. age 52, and she had a metabolic error. We could not label as acidity, gastritis. We could not label it as. So the last physician whom she visited told her ki either you see some psychiatrist or you do some yoga or some Ayurvedic practice or something. So she knew me earlier and then she came to me. So when she did not came to me because she was having few symptoms and she gave me a WhatsApp call. Okay, doctor, I need to talk to you very urgently and please consider me for the appointment. And it's very urgent that I need to talk to you since you know I'm having hypertension and I'm on your regular medicine. Okay, so you need to see me immediately. So somehow we were able to manage and she started her case. So this will be a little bit in vernac medium Hindi and I'll translate it into English for you all. Uh, just be with the case. See, look very simple. We'll just listen to the symptoms and we'll get a remedy. I think so. It's very easy. So she called me and when we had a session, so she told me, doctor, in the morning on waking, I have a cough and it lasts for 2 3 hours, 2 to 3 hours, and then I'm better. And then in the evening, sometimes I have a cough. So the cough is very excessive, doctor. Also, I have cough during sleep and I must wake up from the sleep. And then she paused and then said, doctor, due to fear, my sleep is also reduced. So instantly, fear. So I asked, what fear? So she said, ये जो चल रहा है कोरोना में मैंने सुना है कि लोग सोते सोते ही उनकी सांस रुक जाती है और वही fear है मेरे को. So for at that time this was very common, so I did not paid any attention for that. I just, okay, let's go ahead. What else you have? So she said, और जैसे ही मैं लेटी हूँ with the gesture around her hands this way, she said कि ऐसा लगता है कि कोई मेरा गला दबा रहा है. She paused for a second and then she changed her sentence. नहीं 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 डॉक्टर, ऐसा नहीं, ऐसा टाइट टाइट जैसा लगता है, टाइट टाइट जैसा लगता है. ओके, जैसे ही आंख लगती है वैसे ही खांसी का ठसका लगता है. As soon as I lie down, I have a bout of cough और मैं उठ जाती हूँ and I wake up. ऐसा गले में. Then again she paused for a second. This is very typical. Okay, she paused for a second and ऐसा लगता है गले में कुछ चुभ रहा है. This happened twice. She changed her sentence. Okay. I said, what else? खांसी खाते खाते बेहाल हो जाती हूँ. Like I become like, you know, I don't have this thing. और ऐसा लगता है जैसा सर फट जाएगा. The head will burst out. बहुत वीकनेस फील होती है. नहीं खाती हूँ, आई एम नॉट ईटिंग. नहीं सो के, नॉट स्लीपिंग. सोच सोच कर वीकनेस लगने लगती है. So I keep on thinking and I feel weak. I said, yes, what else? So she has dry cough usually, fever during cough, and respiration was difficult due to cough. So fever, no specific modalities I could guess from the case, no specific thirst, no specific stages, cold or sweat or heat. The fever was around about 100, 101. Okay. Then next I asked, what else you have? She said, doctor, what I feel कि मुझे सांस की तकलीफ नहीं है जैसे कोविड के पेशेंट को होती है. She listened carefully. She saying, doctor, I'm not having respiratory problem as if of what the people of COVID have. मुझे वीकनेस की वजह से सांस की तकलीफ लगती है. किसी भी एक्सर्शन से या वॉक करने से या किसी भी पोजीशन में से मेरा सांस की तकलीफ का कोई लेना देना नहीं है. मेरे को तकलीफ नहीं होती है, ना ही कोई चीज खाने पीने से भी मुझे कोई तकलीफ होती है। मैंने सब ट्राई किया, लेकिन मुझे ऐसा लगता है कि वीकनेस की वजह से मुझे तकलीफ होती है। दैट्स द केस. This is what I had. And then she spoke whatever she had to spoke from her past about her metabolic error, and which was very common, nothing specific. This is what I could take from the case. So what to do now? That's it. Any suggestion, friends, from above this? You can type, we can read, or someone will read for me. Any
Send
questions?
your
Please let me know.
answer and understanding in chat box.
Yeah, any questions? Good question.
Yeah. Come on,
Okay.
first.
So
Whatever you
what will you?
understand in this case, type in chat box. Dr. Shakil is asking you. What is your understanding?
Yeah, from just this much, you have to decide now. Next, whatever she will speak is very much very common, and nothing specific, no modalities, no respiration ka modalities, nothing.
Dr. Priyanka said it's Lactases.
Yeah, Dr.
Priyanka.
Priyanka,
Yeah.
Lactases, very good suggestion. Yeah, very nice. Very, very, very nice.
Dr. Razina said also
Anybody else?
Lactases. Dr. Razina Kasmani said it's also Lactases.
Yes, very good. Anybody else?
Come on, fast guys. Whatever you understood, tell us the
Very nice.
understanding, rubrics, remedy, whatever.
Yes, good.
Okay.
So these
Go
both
ahead.
people, I think so.
Arsenic, again Lactases.
Arsenic, Lactases, Dr. Janvi,
Dr. Yeah, Dr. Deep said
yeah, Dr. Vyas,
arsenic.
yeah. Good, excellent. So many of them knew a right remedy. I think so. The case was so easy. But how I did approach in my clinic? Okay, what was my approach? So for me, two things were very, very characteristic. Respiration difficult due to weakness, and the typical constriction in the larynx. And here is the remedy. Okay, this is as simple as this. A good case taking is very important, but I had decided to give this remedy, but I needed to confirm it from other aspects. So she said, doctor, cough in the morning after rising, cough in the morning for 2-3 hours, whatever she said, cough at night, and I wake up from the sleep. And there is dry cough during fever and a bursting headache. Again, this is a very characteristic. So though I have decided to give a remedy on that first two symptoms which I said, I can share with you again. Yes, respiration difficult due to weakness. Only two remedies. The arsenic also was right. That time arsenic was given profoundly, but I needed to confirm it. So I took the another remedy, and it was very shocking. And again, from this totality, you have the remedy. Okay. So respiration difficult, cough with constriction in the larynx from, and respiration difficult again due to weakness. And on observation while talking, she also said there is some wheeze, but we did not auscultate because it was an online case. But then to in repetization, we took it. So respiration wheezing. See again like SS. And arsenic lies next. This is the importance of the totality as well as your PQRS. If you have good PQRS, you will have a good totality. Along with that good totality, you can be 100% sure that this is your right remedy. Then the whole case, inflammatory fever, dry head, whatever the case, after repetization, only a single remedy coming up was Lactases. And as it was, we decided to give Lactases. Remedy was given. And to the surprise, her constitutional remedy, which I was treating her, was also Lactases. And these were her old symptoms: ambitious to achieve things, jealousy with anger, heart complaints with anxiety, pain in the abdomen with anxiety. There was sleep disturbed due to anxiety. She had an anxiety as if she is pursued of, full of cares and worries, delusion that she has a disease, though blood pressure was not that high. It was around 150, 90 occasionally. And she has that delusion that someone is someone doing on me, black magic. the black magic thing, there are three ways I take the rubric. So this is the one way which I do it. So this was constitutionally given to her, and this is the lachesis we can which we read from our books. Just simply terrified to lie down. This was the characteristic of the case. Sense of suffocation with cough. This was very characteristic. Okay, two different, two definite symptoms of lachesis. One is if all the blood in the body is rushed to the head, bursting headache, and at the same time the head is hot and hands and feet and legs are icy cold. This second one I could not take, could not observe, but the first one was there. So chest symptoms you can learn. She had a respiratory distress, almost to a level of choking. She used to wake up. There was tightness around the throat. See, as it is, what she explained on the video, as it is. And you people rightly guessed the remedy. Just by keen observation, paying the attention to the normal symptoms which we talk, but just looking at that, no deep answering, nothing. Just sit quietly, listen to what the patient has to say, and patient only will tell you, doctor, please give me lachesis. Nothing else. Okay? So sputum and odors, you can read it. And later on, after a month and two, she came to me. She used to call me, and she used to not report anything to me. And later on, after a month, she was much better, and she came to clinic with a big file within her hand. I said, what is this? She said, डॉक्टर ये तो मेरी कोविड पॉजिटिव की फाइल है. आई सेड दिखाओ. तो बोले जाने दो ना, ऊपर वाले ने मेरे को अच्छा किया, तुमको क्यों देखना है अभी इसको. आई वाज शॉक्ड. And she did not tell me that she is a COVID positive patient. She had done a D-dimer which was very high. She did not tell in this to anyone. Okay. In fact, the people from BMC people came to her house. She told कि वो patient तो यहाँ से already चले गई. And she took basic antibiotics at home, self-medication, and then she came to me. So this is how, if you are right in your constitutional medicine, you can give your acutes also very easily. So the two times changing of the symptoms, that time only I was thinking I should give the same remedy which I had given her. But you cannot give. When you're treating the pathology, you have to be very sure that other symptoms are also being covered. Okay. So this is a very simple case. Yeah, this is very simple case. Dr. Pravin, to you, please.
Yeah. Yes, Dr. Shakil. It was a fantastic case, and how you explain so nicely about to how you go with the by separating the totality about totality of peculiarities, totality of curve, and then you merge up the complete totality and you get the exact remedy which was also there into your repertory chart. So it was a nice case, and most of the people come to the same remedy. May I share my screen, Dr. Shakti?
Yes.
Yeah, if you could stop. Yeah. So now, yes. So now we have a second case, very short case from my side, and I'm in the beginning. I want to tell you that it's a very difficult case. So it will not easy for all you guys that how you come to the remedy, right? So are you ready? I hope so. Fine. So into the into the second COVID, as everyone knows that there were so many symptoms. In the first COVID, there was there was very few symptoms as we have gone through the our previous lecture, which was in first COVID. So into the second viral infection into the second COVID, there were so many symptoms, but mostly all the symptoms comes only in upper respiratory tract infection. So in second COVID, it starts with mostly with the fever and chills, right? As you seen, almost if we consider about the 100 patients out of 100, 95 or 90%, we can say a patient comes with the fever with chills, along with the running nose, then sneezing, then coryza, then itching of eyes, and then they develop the dry cough. Okay. Also, they having a cough on eating, cough on drinking water, the cough on talking, typical dry cough with the pain in the throat. Sometimes they get a pain in the ear. These all are the symptoms.
Yeah.
What else along with this? A typical myalgia, typical fatigue, typical weakness, soreness of the body. You know, they are not able to move here and there. These kind of symptoms was there. In very few cases, patient comes with the diarrhea, abdominal, abdominal pain and the diarrhea. But at the stage of cough, there was a severe spasmodic cough. Patient was continuously coughing, 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 coughing. That kind of. So here I am coming with you a very simple case, but a very tricky case, and you people have to solve the case as usual. Ready? So this is a case of a girl. You know, okay, we will come to the also the case. Yeah, let's come with this. Yeah, PQRS. Yeah. So in the we will come to the case later on. But before that, we will go with this. So into the second stage or into the second wave, we what I understood. I'm sharing about my own clinical experience today. So what I understood into the second wave, there was these four stages. The first step, when patient comes to you at the first day, he always complains about or she always complains about the fever with the chills, severe body ache, sneezing, coldness of extremities, coldness of body, shivering, and severe body ache. Then what I found into the second day or into the next stage, they always complains about the fluent running nose, okay, with itching and the kind of we can say irritation in the nose and redness of eyes, redness of uh, throat. Then they were consciously complaining about doctor. I feel I feel irritation in the throat along with the lacrimation. Then they develop the cough. Doctor, something is there in my throat. This comes in a second stage. In Thursdays, patient continuously complaining about doctor, do something. There is severe soreness in my throat. There is severe pain in my throat, along with the cough. And this cough aggravates by talking. Cough aggravates by eating or drinking anything. There is no kind of a relief at all. And after that, they have a severe fatigue. They have severe prostration, severe weakness after the fever and all these first three stages. Or the patient comes to us after after the taking many steroids or many Allegra, cetirizine or antibiotics. Then they develop severe fatigue. So these are the four stages what I understood while handling the patient. So I always go with all these things. But what was into the first COVID? There was a severe, along with fever, along with sore throat, they suddenly develop the pneumonia. They suddenly develop the patches. They suddenly develop the opacity with the breathlessness. Saturation goes down. So this is the basic difference in second wave and the first wave, right? So the mortality rate is more into the first wave, not in the second. In second, there is mostly about upper respiratory tract infection, mostly. So that I understood. Then how to understand about the blood test? Okay, so in this second wave, there is no as such more complications into the blood test. No doubt, in some cases TLC goes high. No doubt, sometimes lymphocytes or neutrophils go also up and down because due to the infection, right? But ESR becomes normal. It goes up to 20, 22, not like about 50 or 60 or 100, which was seen into the first COVID. But also in the CRP mostly goes up to the 10 or 12. It's also nice, not like going to 50 or 60 into the first, first COVID. Same with the ferritin level, same with the D-dimer, also same with the LDH. Okay, so into the second case, you will not get any kind of a severe, changes into the investigation as such, which I have seen in the first. Then how to understand? So whatever is the case, whatever the disease, homeopathy must be depends on only on these few tools. So in the any case, we have to understand the all these five things. Okay, trait simillimum, pathological totality, modalities, clinical symptoms, and one of the most important part what I understood is about the PQRS in second year. This is very very important to understand because we cannot just left the PQRS. Whatever the many doctors or many people give us the the chart or the the we can say a picture of selection of drugs, but the final decision you have to take. You have to understand the PQRS and then select the remedy, right? So here I am sharing you a case of a girl. 23-year girl. She came to me on 19th January 2022. She visited me at my clinic and she called me, Doctor, I developed a fever with severe chills, severe chills. I said, okay, let me know something about you. So my consulting team, Dr. Mukesh, called the patient and he took the history and then she did it the next morning to me. So on first day, she told doctor, I have a high grade fever with severe chills. And doctor, first of all, it started with the chills and then the fever. During fever, there is no thirst. Okay, so thirst is very important in all kinds of fever cases. You must need to ask. So I asked me, tell me something about your fever. So she told, doctor, fever is high, completely high. It's about 100 and 101. But what is most important that I feel severe icy coldness in my palms and feet. I feel there is a coldness in my back, and I feel so exhausted. I just can't tell you. I feel so weakness. I feel so frustration. Doctor, do something. Okay, let me know something about you. Doctor, what doctor, I have severe backache. I just cannot turn up in the bed. If I try to turn the position, I feel severe backache. Doctor, I just not able to move here and there. Do something. I said, okay, tell me something about, along with the chillness and the coldness in the extremities or in the feet, I have severe cramping pain. Okay, I have severe heaviness in my limbs. I have severe cramping pain in my calf muscles, along with the pain in my feet. This is typical. Along with the fever, she develops the headache. The doctor, I have frontal headache. It's completely throbbing. Doctor, I can't understand what to do. If mother asks me, beta, what happened? I get angry. I get irritable on her. Don't disturb me. Don't talk to me. Please leave me alone. Don't come in my room. Okay, doctor. Doctor, I also have a little bit, official work, but now I don't want to do anything. I don't know what will happen tomorrow. My boss will, scold me because already there is so much stuff, office stuff in front of me, and I feel nervous. I don't know what will happen. Doctor, do something. I said, okay. So this was the complete scenario she was talking about me. She was told me there was backache. Pain starts in the back from the occipital region. Behind the neck, pain starts along with the chill, and there is a backache. Okay. So she told me I feel better by lying down. Okay, and aggression by changing the position. This was the case. This was the only acute case in front of me. I said, okay, let me tell. But you know, in the second wave, in almost all the cases, there is a severe chill, shivering in the patient. And why this so happen? It happens because of this cytokine storm. I discussed you this cytokine storm as earlier. Whenever there is the infections, or whenever there is the hay fever, or whenever there is the kind of a viral fever to the patient, to the human body, our body reacts in the form of shivering. Our body reacts in the form of chills. Then and then only this infection goes into the blood, and then there is inflammation at the cellular level, and then this cytokine storm starts. So if you notice, if you know about your patients, they will not complain the shivering to the third day. On third day, they complain about the cough or a throat pain. So at the beginning, here patient develops with the chills. So these patients comes to me into the first stage, on first stage with the chills and the fever. So I have to give more importance to the state similimum. I have to give more important whatever is in front of me. I just cannot go with, if somebody told me to give this, not like this. I have to consider the rubric. I have to take the rubrics as per the case, whatever in front of me, right? So this is the case, guys. So tell me your understanding. Go fast. Tell me about your rubrics. How to understand the case. What are the important points you felt so? Okay, come on. Else I will show you with the rubrics. It will become like spoon feeding or more easier for you. Okay. Is there anyone who want to share your understanding for this? Any rubric, any PQRS, any peculiar symptoms? If you want to share. Okay, fine. So in this case, I took all these rubrics from, as I told you, I always used to use Boning-Usson and Boric repertory in fever case. So from Boning-Usson repertory, I select these symptoms. Okay. fever concomitant back paining, fever compound beginning with chills, then heat. It was typical. Chills first, then the heat. It's there. Then fever compound beginning with chills internal with external heat. So what she told, I feel internally too much chilly, but externally I also having a backache. I having a high grade fever. Yes, somebody said AP's backache. Okay, we'll come to you. Along with that, there is a coldness because of she went somewhere else because of cold. She developed a shivering and partial in also into the back. Along with that, she having a vertigo, concomitant head pain with congestion, fever concomitant stomach thirstlessness, fever concomitant extremities pain in, as she told that heaviness and cramping pain in the calf muscles, also in the feet. Fever concomitant extremities, lower extremities heavy, fever concomitant extremities feet cold. This is very typical. Oh, fever concomitants generally is lie down inclination to I cannot able to sit up doctor. I want to lie down all the time. This is a typical pathological catarrhal fever, pathological types cold taking fever, aggression by motion, and concomitants mind peevish. Means you become irritable in the fever. You don't become more sensitive. I don't want any kind of disturbance. So this is the all these symptoms, all this rubric I took from the from the burning Usman repertory, and here we have the remedy, right? So it's very easy to all of you to select the remedy. Yes. So what to give? We have sulfur, we have belladonna, we have sepia, we have arsenic, china, rust of aconite, phosphorus, ipecac, ignitia, brownian, atom, calculated. So tell me what to give now. Come on. Anybody else? Shakil sir, also you can share for this case your thoughts. What we can give. Just let's have a discussion, right? Other than the
Yeah,
presentation. What
yes,
do you
sir.
think? What do you think? What to give? Just have a thought, sir. Rust talk. Somebody said rust talk. Janvi said rust talk. Okay, you are closer. Anyone else want to guess the remedy or want to tell your PQRS or the symptom? Yes, Akil sir, any thought? Any idea?
No, no, sir.
Just a thought, any idea? It's not about China. Dr. Vijaya said China. Yes, very close. You can arsenic. Dr. Meenakshi said arsenic. It looks like arsenic on the restlessness, the chills, thirstlessness. Yeah, closer. Mental symptoms. Absolutely, Dr. Meenakshi, you're absolutely right. Mental symptoms shows that it can be arsenic. Right. Yeah. So we'll tell you irritation with anger, restlessness, bravania. Yes, Dr. Well from Goa, Dr. Well Mendoza from Goa. Bravania can be a remedy because of soreness of body, restlessness, high grade fever, irritation with anger. Definitely. Okay. So we'll tell you what to do. I will come to you. Okay. So as I was going through all the cases and I tried almost all the remedies. So in this case, what I understood that there was a severe chill. What is important in the chill? Chill was mostly in the extremities, icy coolness of extremities, also in the back. It is very typical and picturesque. But another point at the mental level, she was completely irritated. She was completely nervous because of her work. She was completely angry, sensitive. Okay. So if you see into the repertoire chart very closely, if you try to go, okay, most of the symptoms covered by arsenic, except these three. Which one? Fever, concomitant extremities paining, fever, concomitant extremities, lower extremities, fever, extremities feet cold. Okay. Except these three symptoms, all symptoms are covered by arsenic. Like, okay, but which is not covered by arsenic covers by China, right? So what it means, what I understood, because already given to the medication only arsenic, only China, it was not help to up to that extent. There was a partial results. There was a partial, result to the patients. So then I try to understand. Yes, absolutely right. So I try to understand how to give, how to go, because in this repertoire chart, I could not, consider the exact PQRS. in any acute case or any fever case, you must need to depend or you must need to rely completely on PQRS, because PQRS is the only symptom which gives the damn sure hint for the solution of remedy. So then I try to understand it's not also covered by China or also not covered by arsenic. Then what to give? It's a combination of both. I thought it can be a combination of both. Then let's try to learn about it, try to read about the Chinium Mars. Then I went to Matra Medica. Okay. Then I went to Matra Medica. Then I learned about Chinium Ars. Then what I come to know? Chinium Ars is nothing but an arsenite of quinine, right? And if you open the boric repertory or if you open the boric into the generalities or into the fever, its first PQR is given. Chilliness, location, hand, back, feet, and the knees. Okay, febrile heat. Febrile heat concomitant prostration, severe prostration. What was the PQRS? Chillness with hand, back, and the feet and the knees. So into this case, first three chills location is completely there, hand, back, and the feet. What else? There is a type of influenza debility. Almost this fever comes with the viral influenza fever. Okay, so this is exactly given into the China Rs. What is the origin China? Is arsenate of quinine. O- Okay, what else? What is given in boric about the China Rs in the extremities? There is a weak limbs. There is a coldness of hands and the feet and the knees and the limbs. Tearing pain in the extremities. Okay, there was a cramping pain. Okay, along with that, what Dr. Pathak told about the Chinium Rs. Dr. Pathak told into the generalities weakness, weariness, prostration, and disinclination for mental work. Okay, then irritability precedes headache, right? Along with the sudden attack of vertigo, worse looking up. What else? It's given also in Pathak coldness of hands and the feet, knees, and the limbs. Again, it's given there. Okay, so what it means? Hmm? There is a continuous fever with oscillating temperature. Means she came to me, she told me at night, doctor, I develop 100 fever and it's continuously increasing. It goes up to 101, 102 like this. Okay. So in this stage, okay, where I give importance? In this stage, I give importance at PQRS. Okay. Though you are, see, yesterday, last time also I told you, your repertory charge is not a final decision. Repertory is a tool to guide you which to select. Okay, but if I could go with only with the repertory chart, definitely I can go with the Bryonia, I will go with the Belladonna sepia, arsenic itself only or China itself only. But as a clinician, I must need to understand अभी तक जितने पेशेंट आए वो फीवर चिल्स आते थे, but here typical chills in the palms and the back and the extremities. This is the PQRs in this case. Okay, so then I gave her Chinimas 200 into the repetition. Okay, let's have a follow up, very small follow up. So the next morning, my consultant team, Dr. Mukesh, called me, asked me, sir, how is about that patient? She was better or not? Okay, so we'll show you a small follow up, very small follow up. Minute. So what it means, you always need to understand when and how to prescribe. Okay, why is this so? Because you just cannot depend only on your repertoire chart, my dear friends. While selection of the remedy, you must need to consider the repertoire, the mater medica, your clinical understanding along with the pathological understanding. Okay, especially in all kinds of acute or pathological or fever cases, right? So sound clip, and here is a follow-up. Next morning she came to my clinic and let's see. We'll also narrate in English. She's a Marathi patient.
बोला प्राची ताई कसं आहे तुम्हाला?
It's audible?
पूर्वीपेक्षा बेटर वाटतं.
काल आपण औषध दिलं ना?
हो.
काल तुमची
Yes, yes.
घेतली होती
सरांनी घेतली.
डॉक्टर मुकेश फ्रॉम मुंबई.
हां हां त्यांनी घेतली.
सो काल ताप किती होता?
काल ताप मला 100 होता.
100 सकाळी 101 समथिंग काय ते. आणि आज सकाळपासून
आज सकाळपासून कमी आहे 97.
97. कसं
97.
होतं पहिल्यापेक्षा?
पहिल्यापेक्षा खूप बेटर फील होता. बॉडी पेन खूप कमी आहे.
थंडी
थंडी पण नाही वाजत आहे, काल खूप
हातपाय
थंडी
थंडे
होती. नाही पडत.
आणि झोपलं एका कडेवर तरी दुखायचं,
हो,
इकडे झोपलं
बॅक
तरी
पेन
दुखायचं.
वगैरे होतं, साईड पेन होतं, बॉडी पेन आज नाही आहे तसं.
किती टक्के बरं आहे आपण?
ऑलमोस्ट नाहीच आहे.
नाहीच
हां.
आहे. फिवर नाही
This
आहे,
is the
डोकं दुखतं
achievement
आता?
for
नाही,
us.
डोकं नाही दुखत.
चलो ठीक आहे, काय अजून काही?
अजून नाही
नाही,
काहीच.
चलो काय. बोला प्राची ताई, कसं आहे तुम्हाला?
पहिलेपेक्षा बेटर वाटतं.
काल आपण औषध दिलं ना?
हो.
काल तुमची हिस्ट्री कोणी घेतली होती?
सरांनी घेतली.
डॉक्टर मुकेश फ्रॉम मुंबई.
हां हां त्यांनी.
सो काल ताप किती होता?
काल तर आपल्याला 100 होतं.
100. सकाळी
It was 100.
आणि आज
Morning at
सकाळपासून
101.
आज सकाळपासून कमी आहे.
Since
97.
morning, no
97.
fever,
कसं feel
97
होतं
fever.
पहिल्यापेक्षा?
पहिल्यापेक्षा खूप बेटर.
I'm feeling so much better, doctor.
थंडी,
No shivering, no chills,
हातपाय थंडे,
no fever,
नाही पडत.
no colds in the
आणि
palms,
झोपलं एका कडेवर तरी दुखायचं,
हो,
no
इकडे
backache
झोपलं तरी
on
दुखायचं.
changing the position,
बॉडी पेन आज नाही
no body
किती
ache.
टक्के बरं आहे आपण?
I'm almost nothing, no
Fever
symptoms,
नाही आहे, डोकं
doctor,
दुखतं आता?
no headache, nothing.
चलो ठीक आहे, काय.
So this is the great achievement, if somebody asks you, uh, how can homeopathy, help so far? So here is the answer. If you have an exact PQRS, if you are too confident about your prescription, okay, that it will like a magic. It will like a miracle. Or even also in last few months, I have treated cases from Goa, cases from Mumbai, from all over the especially for the second wave. I'm telling you. So in this case, chill is very important. The picker is very important. What else? As we don't have too much time, because Dr. Shakil also have a second case, so I'm giving a description, short description. In second stage, mostly patient comes with the throat symptoms. Okay, so there is irritation throat. They comes with the redness, congestion, inflammation, dryness, and the sometimes coryza and the fever. So if you consider all these rubric, here we have a clinical rubric. So we can say clinical findings into the repertory chart or into the rubrics. So you can take a picture. Throat roughness, scraping sensation. This is the most common sensation in all the patients. They complain, doctor, do something. I feel something like a itching, irritating, scraping here in the throat. This is the most common sensation in all second stage of second wave. Okay, if you consider all these things, most of if you consider all these rubrics, hawking sensation, cough sensation, roughness in the throat, itching, I just not able to swallow while taking the while taking the water, all that I feel roughness, I feel pain in the throat, sometimes I feel dry, sometimes I feel mucus. So most of the time I came to the two remedies, that is Sabedilla and Seneca. Okay, so what to give into the both of these? So as if we consider the symptoms and the repertory, here we must need to understand what is the pathological action in the throat. The pathological action in the throat is there is a destruction of mucous membrane. There is a problem in the mucous membrane. There is the redness, there is the inflammation, and the destruction in the mucous membrane. That's why the scratching sensation to the patient. That's why there is a severe cough. That's why they are not able to lie down on the bed. As soon as they go to the bed, they develop a cough. So rather than the clinical symptoms, I give more importance to the pathology as always. So most of the symptoms covered by Sabedilla and Seneca. So when to give Sabedilla, when not to give Seneca. So Sabedilla we can give into when there is a dry cough mostly. Seneca covers the mucus, cough with the mucus, but the scratching is a common. Cough is a common. Along with both the remedy covers with the cough with the pain in the ear, cough with the lacrimation. It's given in the part of mucous membrane of nose, lacrimation gland. Okay, there is a nerves are affected, producing weakness, severe weakness. What else? Sabedilla given by Pathak in respiratory organs, violent coughing attacks, muffled, worse by anger, cough with the lacrimation. They feel breathlessness while coughing. Okay, paralytic debility, so prostration. Then in Sabedilla by Boric, it is given action. Sabedilla action mostly on mucous membrane of nose, throat, larynx, pharynx, means action of on mucous membrane of URTI, on upper respiratory tract infection. And Sabedilla infection of Sabedilla symptoms is quietly close with euphrasia, quietly close with allium cepa. So this is the most important remedy you can give into the winter coryza, but you must need to understand or consider the pathology, right? Also, along with chilliness, sensitive to cold, what they give, you can give this remedy mostly in the hay fever, mostly in a fever which comes into the infection or a viral like this. Also, what given in the nose? Okay, it's a copious watery coryza, fluent coryza. Doctor, I am not able to sit down. If I sit, there is a dripping of nose and I feel so redness, so itching. Do something and then cough starts. This is covered by Sabadilla. What is covered by Seneca? Then what to give? If patient comes to you, if patient develop the wheezing that Dr. Shakil, into Dr. Shakil case, he told that I just could not able to take go for auscultation because there was wheezing. If in your clinical finding in the clinic, if there is a wheezing in the chest, if patient told that doctor, I have a scraping sensation, hoarseness of voice with the sputum in the cough, then definitely go for Seneca, right? Because you will get the same sensation, dry scraping in words by talking. You also get dry scraping in Sabadilla also, right? So these are the symptoms. But you know what is the most common in this second wave? You will get most of the remedies from offensionalis group. China offensionalis, Sabadilla offensionalis, Seneca offensionalis. Most of the remedies come from the plant kingdom, right? So we'll go fast because these are the common symptoms that are mostly used in second wave. Okay, you can take a picture. Cough, dry, scraping, larynx form. Cough, dry, scraping, throat form. Cough, dry, pharynx, larynx. Sensation, mucus. This, and most of the time, if you go with all the totality, you will get mostly Seneca and Sabadilla, along with Pulsatilla, Naxomica. Graphite is also an important remedy. Bromium also covered the most important remedy. Calicarb also. We'll tell you when to use Calicarb. Okay, so this is a short description and the remedies which I use in second wave for these four stages. In first stage, I mostly use China Rs, okay, Bryonia, Belladonna, Gelsemium, Epiduria, mostly severe body ache, no chills and severe body ache. High grade fever, go with Epiduria. For chills and the fever, I also use Elapse along with China. Okay, then Cedron also helps me in most of the cases. If severe changes in the blood level, I also tried Streptococcus, okay, Pyrogen also. In second stage, mostly if throat symptoms comes, I give Sabadilla and Seneca both. Also the Kali Bai. What is the most common symptom of from Kali Bai? Is a little bit sputum and fluent coryza, fluent running nose. I give Kali Bai. Okay. Then if patient develop follicles into the throat, or if patient develop the we can say severe infection in the throat on the tonsils or the pharynx, I always prefer to go with the Baradacar, which also gives results based in the throat infection. In third stage, I also prescribe Kali Bai, Kali Carb, because most of the patient told me, doctor, with the cough, if I take a deep breath, I feel burning. I feel burning in the chest. If you try to go to the respiratory open, uh, chest burning cough during, you will get Kali Carb. And why Kali Carb helps into the for the burning of chest? Because Kali Carb having a very good action on the on the pulmonary, on the lungs. I have told you in last lecture of COVID, along with causticum. So what most of the remedies comes in mineral kingdoms from the potassium group. Kalibai, Kalicar, Kalifos, causticum, graphites, all these are the potassium. And potassium is the most important factor for the respiratory system, actually for the pulmonary, for the lungs to take oxygen from the arteries and circulate. It helps for the also for the surfactant. That is why potassium remedies comes most of the third stage if there is an infection in the lungs, right? Also the bromatum. If cough with the wheezing, go with anti-marps, anti-mtrat also helps. Then comes the last stage of fatigueness. I use phosphoric acid. I told you last time also. Then sepia. Why sepia? Because sepia and phosphorus will come together. If there is a reduced platelet count, go with the sepia or mother tincture of Caraca papaya. Carbohydrate also helps me with the what happened in post-COVID. Most of the patients complain, doctor, I feel burning in my palms and soles, especially in the old age. They complaints about neuropathy, senile neuropathy, or we can say post-fever neuropathy. Then you also go for carbo veg or a China. Okay, patient always patient told, doctor, I feel so weak, so feel ऐसा लगता है अभी टूट गया मैं, अभी टूट जाऊंगा, चलना भी नहीं हो रहा मेरे से. Always think of Tuja. You can go like this way. So these are the most common remedies which I use in my clinical practice into the second wave, right? So this is a very small, we can say a session or description for me in my clinical practice, and I shared with you. So again, Dr. Shakil, I would like to hand over mic to you for your one of the most beautiful and deep pathology case of post-COVID cardiomyopathy, right?
Yeah, right.
Yes, sir. Please go ahead.
Okay. Thank you. Nice.
Yes, yes. I tried to describe in short time and in a short. Go ahead.
Okay.
You can share the screen. Yeah.
So welcome back again. This was nice case by Dr. Pravin. Even I was not able to get the remedy. So excellent learning. I said, no, he is an excellent clinician. And his understanding of remedy is very excellent. During FCH exams, we were very close. And Dr. Pravin was discussing few remedies. And he came to me and he asked me some keynotes. uh, I listened to him thrice, and then I quietly went away. I said कि नहीं भाई तुम्हारे इतना मेरे पास knowledge नहीं है. So this is an experience of our fellowship. And then till my exam got over, I did not see Dr. Pravin. So such a tremendous knowledge he has. Okay, and the understanding, even I was not able. I was thinking of China, but China was not fitting into the case, so I could not answer. Okay, fitting into case is a wrong word. We should not fit anything into a case. We should understand. Being a clinician, we need to understand. Rightly said, we need to understand. So I'll share one of my case. Yeah, but about the last case, she did not showed me the reports, whatever she had. Just I was able to take just a gradual look. No records I have about that. And she took it, and then later on I came to know that she threw it away. So did not share that thing. So this is This is also one of my old patients used to come to me for arthritis, and she was 67 years aged. Known case of arthritis, hypertension, anxiety, and on 15th May 2021, she had an acute COVID infection. She was then admitted to the hospital. Okay, so after 2-3 months, this was the picture sent to me on my WhatsApp. Okay, so this was the first picture. This was the second picture. I suppose this they have sent us to see the liters of oxygen they are sending, but the readings has been not shown here. And then this was the report they sent me. We'll read in the conclusion part. There is suggestive of airway trapping could be due to the obstructive small airway diseases. Okay, and mild pleural thickening as common after heavy steroids. There is fibrosis, and the note written by the chest physician from the hospital. The prognosis is extremely poor, bilateral viral pneumonitis, and after 3 months also the X-ray is showing the same thing. Okay, and there is an extensive fibrosis. This physician is an expert person, and his diagnosis is not doubted by any other physician in our area. If he has written, then it is like that. So that is why I have taken a clip of it. And this was the one of the reading which was sent, and in the note below it was written, डॉक्टर ये 27 भी हो गया था. उस वक्त हॉस्पिटल के लोगों ने कहा था कि हॉस्पिटल में से आपका पेशेंट लेके जाओ, इनकी कोई उम्मीद नहीं है. Then she insisted, and she called me at that time. I remembered, but this was a senior I was not knowing, and I repeated her remedy, whatever constitutional I was giving, because I had no totality. I did not talk to the patient, and what she was talking, her daughter. So she was just talking about some common symptoms of COVID, of treatment, of the harassment there. So I could not give. So I better said, you take your constituent. She was much better. Since 1.5 years, she was coming to me, and then she did not call me for about 2-3 months. So I did not inquire what is next going on with her. So this is after 2-3 months she sent this, doctor abhi condition filhal aisi rehti hai. Then I decided she cannot come to you, doctor. If it's possible to you, you just come and visit. Okay, I said I'll just go. So I went, and this was the position in which I saw her first. As soon as I entered, this is what I have seen. Okay, then next I sat, I took the history completely, and the case begins now. Okay, this is after the case which I took, and the case begins. Okay, now again, see what I do in my practice. I'm going to share that. Okay, so I just do very simple things. I don't I don't add, subtract, or I don't multiply. Okay, I don't think in a cross way, other ways. I have very simple approach. I have, many of my cases are doing well with phosphorus, lycopodium. My rustox cases, my phosphorus. Yesterday I had a good case of COVID, case to COVID, a small girl had been infected within fever 104. Within 16 to 18 hours the fever came down, vomiting came down, loose motion came down. Simple remedy as phosphorus was given. Just mere simple understanding. Okay, I prefer to go very simple because I'm not that learner as Dr. Pravin and other teachers. I'm a lazy man, so I do very simple things in my clinic. Okay, so while telling you the symptoms in the process, you may be able to get the remedy. It's very simple. So old patient of mine, known case of rheumatoid arthritis, diabetes mellitus, hypertension, was admitted to the COVID hospital and treated with the modern medicine. The reason for being treated with the modern medicine, because she never takes allopathy. That's why I mentioned this. She insisted me to take, but there were no means of communication. I could send the medicine or she could come and take the medicine. So she had to get admitted in the hospital and she was treated with all the possible treatments there, all possible injections. I need not name it, all possible steroid. I have all the records, all the file present with me only. So after discharge, consulted me for continuation of the treatment, and the request was, ki, can you help me to get rid of this machines? I'm having two machines at home. I'm rented. It is 10 liters per day, during 8 to 10 liters in the day, and sometimes 10 liters at night also. So I said, well, now tell me about your complaints. So following were her complaints. Doctor, cough in the morning, breathing while, cannot talk. Well, this is all into vernacular medium. I've just converted as it is. I try to make it as it is. Okay, the symptoms I'm writing into English, but the sequence, the patient said, डॉक्टर सुबह में मेरे को खांसी आती है, सांस लेने में तकलीफ होती है, मैं बात नहीं कर सकती. This was her symptoms. So I've tried to convert it as it is possible. Translate as the patient said. So expectoration more in the morning, then later become difficult during day. सुबह सुबह बलगम वाली खांसी रहती है और जैसे जैसे दिन निकलता है मेरी खांसी सूखी होने लगती है. ओके, cough dry and sometimes expectoration difficult, would come out with much difficulty. खास खास के निकालना पड़ता है. Respiration, perspiration at night with cough. Okay, so very simple. You will get the remedy with this only. I need not explain. Now listen the second part. डॉक्टर सीने में दर्द होता है, radiating to the arm and the shoulder. There is a chest pain and it's radiating to the arm and shoulder while coughing. So she was not able to make a gesture, or she was not able to tell which side, right side or left side. Pressing type of pain, ऐसा लगता है कोई दबाता है. In the chest while coughing, खांसते वक्त ऐसा लगता है कोई ऐसे दबाता है. Shortness of the breath. Okay, again you are simple. These all are the symptoms of the medicine which I gave. अब तक सबको रेमेडी आ जाना चाहिए. रेस्पिरेशन वॉज वेरी इवेंटफुल, मीन्स डॉक्टर जोर लगाना पड़ता है. पहले जैसा आसान नहीं है अभी सांस लेना मेरे लिए. ओके, इट्स नॉट वेरी इजी. इट्स नॉट वेरी इजी फॉर मी टू टेक अ ब्रीथिंग. देयर इज होर्सनेस इन द मॉर्निंग ओनली. ठीक है, डिस्निया ऑन स्लाइटेस्ट एक्सर्शन. थोड़ा भी हालचाल करती हूँ तो मेरे को सांस लगती है. मेरा सांस खो जाता है, मतलब आई एम लूजिंग माई ब्रेथ. दम घुट, मतलब मेरा ऐसा लगता है कि अब सांस निकल गई, अब वापस नहीं आएगी. इवन कैन नॉट गो टू द वॉशरूम विच इज फ्यू स्टेप्स अवे फ्रॉम माई बेड. ओके, weakness, unable to do the routine work as changing clothes, going to washroom. Okay, it's out of imagination for her. Breathing anxiety. This was something which is very common during my practice, where I practice. Each and every patient come and you should tell me about, डॉक्टर 16 बार सांस ले रहा हूँ एक मिनट में, 18 बार सांस ले रहा हूँ मैं एक मिनट में, डॉक्टर 25 हो गए, डॉक्टर 30 हो गए. So I used to take it just to find something new which I can get. So sometimes it is good, sometimes for no reason it is fast, and sometimes must take breathe as if it would stop. जोर से सांस लेने लगता है कि अगली से लगता है कि अगली सांस आएगी ही नहीं. Keep a watch on breathing. Okay, and respiration was difficult at the time. She could not sit for long and from the slightest motion. Okay, very simple. Again, if you must have got the remedy. I must get out of the bed to offer my prayers at least, doctor. This was a request. I should not be dependent of my work. Even changing the clothes is becoming a task for me. Going to washroom is also a burden. You know me, doctor. I am very strong at this age. With all my limitation I have, being a old patient, I know her. So she was was talking into the old context, and there is a few lines she spoke to me, which later on I'll share. I don't want to be dependent on others for my work and also for the other things. Because I know her history, I know her background, family background. So this is what she spoke to me within a span of time, and then she was very breathless. Then the nebulizer was there in front of me. The nebulizer was given once, and she stabilized. And the doctor said, "कि अब मम्मी तुम ज़्यादा बात मत करो." And then that's it. I could have to stop the case. But by this time, I was sure of some remedy. Okay, so this is what it is. It was available from the case. Okay, now I'll share something of from the past. Okay, now just listen to how breathless she is. Okay.
बस यही है और कुछ नहीं, यही मतलब सांस की तकलीफ है ना,
See how breathless she is.
वो हो जाता है। अभी इसलिए मैं यही करती हूँ,
Istinja
टॉयलेट
means
में आई
toilet.
तो गई ना, तो मेरी जान वो हो गई थी। नहाई इतने देर के बाद तो ये लेकर गए थे उधर, ये लगा हुआ था, और फिर जल्दी जल्दी नहा के वो आ गया। ऐसा मैं टॉयलेट में नहीं जाती, इधर, हाँ इधर ही करती। ऐसा है, अभी गई नहीं, मैं अभी कोशिश नहीं करी।
अच्छा
मैं आई जब गई तो मेरी हालत खराब हो गई एकदम।
अच्छा
हाँ।
लेटने में कोई तकलीफ?
नहीं नहीं, हाँ, खाना खाती, मैं तो लेटे लेटे ही नमाज भी पढ़ती थी मैं। अभी मेरे पैर सुन हो जाते हैं।
अच्छा
हाँ, ये
और
1 महीना सो सो के पूरे से मैं तेल लगाती थी।
और कोई तकलीफ?
नहीं नहीं।
So she was very breathless. This is the last which I was able to record. So I recorded on my phone, and she says ki even for the toilet and urine, I don't go to the bathroom, which is just next to her room where she was lying, just next to it. But everything was made very close to her bed. I said the first photo, if you remember, there is a chair, a commode chair, which was made available for her, and she was very breathless, very breathless. Okay, so this was the case. We have listened to her now, how breathless she is. Now, what she told me, doctor, आप सब जानते हो. So I'll just give a glimpse from the background, because last case I told you, she was constitutionally, she was Lactases, and from the acute totality also we were able to get some good symptoms which fitted into our, again wrong word, fitted is not a word. We got some symptoms which she told, and we repertorized and were able to give Lactases, and she was much better. Okay, so her life space is she has 2 daughters, both married, and one daughter was taking care of her during COVID. And that day also when I visited, she got married late, being very beautiful, 36 years of age, and she got very widowed very soon. Her husband met an accident in Kenya, and from then onwards, did not depend on the others for her needs. Okay, she did not have her own house. 2 daughters were born. Since then, she's on a rented house. Used to sell some religious books. Okay, teaches some religious things, and brought up both of her daughters single-handedly. And she did not ask for money or something from her brothers. Both brothers they are very affluent people in the society. So, as I said, rented house, she manages everything on her own. Brothers are rich and affluent. With all these complaints and rheumatic pain, she manages everything. Okay, she has severe osteoarthritis. She has a prolapse of intervertebral disc between L4 L5. She cannot bend. She cannot do her knees are degenerating both sides. The shape of the structure of the knees is being changed to her abnormal posture. The walking is impossible. With this also, she does all daily routine activities. Okay, she cooks her food. She offers her prayers 5 times a day, and she sells the books. Okay, after if she has to shift the house after 10 11 months, she does it on her own. She manages. She does not take help of anybody. Even financially, she's very, she's very um, uh, self dependent. She's not dependent on anybody. So I'll tell you what remedy I gave her. So with rheumatic pain, so based on this, uh, I learned the personal evolution method from Dr. Gandhi. So from there, laws and orders, there was a rigidity. This she did not did out of the strictness she followed, was the rigidity in her. Okay, she was not like a bossy thing and she does not want you to take, or she felt inferior, something like that was not missing. So rigidity and stiffness. Religiousness was very prominent. Religiousness I understand in two ways. One is religiosity, and secondly consistently doing things with ardently following rules continuously, not breaking your own rules. For me, that also stands as religiousness. Work and inability to work and overdoing in a rigid way. Okay, there was no need to, like, not to take support. The two brothers she has are very affluent people. Okay, financially also they are very, very, very rich people, so she could have taken it. So out of rigidity, there is stiffness better by motion and work amelioration. So from there, from the understanding there, fifth subclass, Sapendalis, and the Anacardiaceae family, Rustrox was given, and she was much better. She changed as a human being. She started meeting her brothers. Okay, she's allowing the daughters to come to the house. She's liberal with her not daughter-in-law, granddaughter, grandchildren. Okay, the rigidity has been reduced. She's mixing up with the people. Okay, she's understanding. Initially, she used to come to my clinic once in 3-4 months. Now she frequently visits. Medicine used to go every month, but she's a strongly rigid lady. Okay, not that iron lady. Okay, not Iron Man thought of thinking, the other way. So depending on this, I gave her a stock. She was much better. But now what to do? We have the above totality, which she said. From her breathlessness, you heard the voice. Now we have the above symptoms and no other totality. So what to do? Just simple. Collect all the symptoms. It's already for you converted into the language which we normally use. Okay. So I'll give you a second day ka follow-up after 4 doses of my remedy. Okay.
यही मेरी ये होता है ना, आज कल से आज मैं बहुत अच्छी हूँ.
One more time, we'll listen. Only 4
यही
doses.
मेरी ये होता है ना, आज कल से आज मैं बहुत अच्छी हूँ.
So now you all people will tell me the remedy. Yes, everybody. The remedy is very simple. First remedy, so you all could guess very nicely, very easy, very, very easy, in fact. Yes.
Yes. I hope others can crack the remedy. Again, Dr. Priyanka, Dr. Meenakshi, come on. Whatever you understood from this case, whatever is your observation, whatever the rubrics you took, you have taken, or you felt that this is important, share your thoughts. This, this we can call it a table learning. You will not get anywhere. This is the only chance where you can share your thoughts, your understanding. From that you can learn from your mistakes.
Yes. If you share, we all will learn.
Stanament. Dr. Rama Devi said stanament.
Yes.
Okay.
Very good. Very good.
Good.
Very nice thinking process, Dr. Rama. Very good. Anybody else?
Yeah, Dr. Deep Vyas said Pravin.
Yes. Again,
come on.
Good, nice thinking. The thought process behind the remedy is very important. The remedy is not important.
Yes, I always tell that remedy is not important. The process is important. Once you learn the process of the stalwarts, you can do anything.
The process,
right?
If you understand, yes, process is
Yes.
important. Remedy may be some, if your understanding is good, your remedy is also good.
Yes. Bravnia. Dr. Rohan Das said it's a Bravnia. Okay.
Yeah.
No problem. Yes. We have 26 participants in Zoom. We have 5 participants in YouTube. And we have only 3 answers. Why is this so? Yes, Dr. Nia. You have raised the hand. You can tell. Okay. No problem.
Okay, so we'll go ahead with the case.
Yes, sir. You can go ahead.
So as usual,
नहीं
so we'll have repetization for cough, for respiration, and in general. Okay. So from the symptoms, it is understood that Rustox won't help. She cannot move only. So better by motion is to be forgotten totally. Now, new totality, new remedy has to be taken into consideration and rethink in a new process. Even then, after thinking in a new process, you get the old remedy, you can give it. Okay, no issues. वी आर नॉट वेरी आर्डेंट कि अगर मेरा रस्टॉक्स था तो मुझे एक ही रेमेडी पे पूरा केस निकालना है, मैं इसका दूसरा रेमेडी दूंगा. रस्टॉक्स हेल्प, शी वाज ऑन 27, it is better now, she is on 37. Okay, PCO2 level is 37, she's better, she's alive, we have a chance to treat her. Now the problem is not survival, the problem is she should get rid of her all her complaints. Okay, so we'll go ahead. So this is the thing which I took for repetization. Respiration difficult from slightest motion. Oh, sorry. Yeah, respiration asthmatic sitting aggravation. Now she said in the video that बैठने होता है, but she was not able to sit. Okay, and respiration difficult sleep during. Okay, few more suggestions were calcarea carb and bryonia from Dr. Meenakshi. Good thinking. So respiration difficult slightest, asthmatic sitting aggravation, and sleep during. The only single remedy which covers the three is digitalis. Okay, but this is one part, no? Still are 3-4 better remedies, opium, sepia, arsenic, they are still in line. We cannot ignore them, right? I should be damn sure, because she's not able to walk and her oxygen level is still high. She was on steroids till the time I visited. So now cough totality. Perspiration, night, cough wet. So for me, this was a purpurous symptom. Okay, I'll tell you what rubrics I took while I was repetization, and then the totality which I on the basis of which I gave the remedy. Cough dry, talking while. Cough dry morning, rising after, and cough breathing aggravation. सांस लेने से भी खांसी शुरू होती है. Again, from the cough totality, we have digitalis. Okay, now back remedy were Kalikab, a good remedy, then Rumex and other remedies. Now the whole totality, right? And this is the remedy. So exercise after, sitting aggravation, asthmatic walking aggravation, desire for deep breath, respiration difficult, eating while, respiration difficult from slightest motion. She had palpitation with respiration. But these were some common rubrics, so I did not mention earlier. So I took whatever I took for the first two slides. Now digitalis, there is hoarseness in the morning on waking and frequent painless hoarseness. This was the characteristic of the case. Now cough with sweat at midnight. Dry cough with pressive and tensive pain in the arm and the shoulders. The expectoration is involuntary in the morning by hawking, involuntary hawking, and expectoration is bloody colored. The expression from the chest, colored bloody. These are the very PQRS characteristic of the case, which is present in my case. She was gasping for breath, sighing respiration, and desire to take a deep breath. Chest could be only half filled. ऐसा जोर से सांस लेना पड़ता है. Impend to take a deep existed deep in the chest, as though some impediment existed in the deep chest. And one more rubric is when sitting as well as when walking, worse, and that is towards evening. The shortness of breath appeared in a slight degree immediately on rising, but the symptom is very good to understand. She told me this symptom, but while taking the case, I ignored it. But when I was studying digitalis, I came to know few days after, when I was like a day earlier, they are better. Some symptoms are aggravated, the next day the symptoms get disappeared. So this is very characteristic. This is written here. The shortness of the breath appeared in a slight degree immediately on rising the previous evening, and it soon disappeared in the bed. Okay, weariness and general affection of the chest and frequent dry cough. There is next day shortness of the bread, because this all were, I thought this is due to the allopathic medicine she is taking. So I did not took it. But when I was studying, these symptoms were present in the case. Okay. Distressing dyspnea for several days. He must involuntarily take a deep breath. Isn't it, friends? She said. So from Boric, this is from Allen's. Now, from Boric, weak, irregular, and intermittent, abnormally slow and dropsy of external and internal parts, weakness and dilatation of the myocardium. Okay, slow pulse in recumbent posture, but irregular and dichrotic on sitting up. This also is a very characteristic of that case. The cardiac muscular failure and hypertrophy of the liver. So atrial fibrillation, what is atrial fibrillation? I will explain. So it is a typical rhythm set in the upper part of the heart. It signals and it helps in proper pumping. But in atrial fibrillation, this signal starts from everywhere from the heart, and heart starts to fail. Okay, then we have irregular, fast, irregular heartbeats. So the doctor then, the chest physician also said this sentence to her daughter कि इनका यही हाल रहा तो आहिस्ते आहिस्ते ये हार्ट फेलियर की तरफ चले जाएंगे. So in my clinical tips, in my clinic, if there is a chronic cough, she was having cough since 3-4 months. So differential diagnosis in the geriatric age is left ventricular hypertrophy. I never miss it. Okay, there may be, you may be able to see the ECG changes also. So you need to, but you always think if a patient in a geriatric age, above the age of 50, if he's coming to your clinic and is complaining of hypertrophic, is complaining of the cough, chronic cough, don't ignore it. Okay, it's not that easy. ये तो chronic रहेगा, ये तो allergic रहेगा, ऐसा मत सोचना. You think first of this, think of a passive tuberculosis also. One is active tuberculosis and other is passive tuberculosis. So think of that. And thirdly, lung fibrosis. Those people who work very hard in their initial phase of life and later on, due to some reason, they're getting all the luxuries they want, and they have suddenly stopped doing their normal course activity also, like standing, having a bath on a daily basis, or taking a routine work, like standing for themselves for some 5-10 minutes, standing for a bus, standing for a rickshaw. They have stopped doing that. They call auto rickshaw at their doorstep, sit and go. And they enter straight away to their houses where they want to go. Till there, they carry the rickshaw. Such people, they have this thing. You never forget this thing of lung fibrosis, especially after the COVID. You make it, and after, especially after the treatment of COVID. Don't ignore these three things. So this was a simple case of digitalis. Now, understanding the cough clinically becomes important part in our practice after COVID treatment. So patient will come to you with some lung heart pathology. Don't ignore now the chronic cough which I am seeing. I have, like, since last 2 months, at least 10 to 12 cases from my practice. I have these patients. Okay, but everybody have not given digitalis. Okay, it's a different remedy from everything. So why does this heart fail? What is the cause of the failure of the heart? Okay, and it causes the cough. So with heart failure, sometimes called congestive heart failure, the heart is unable to pump the blood efficiently. The pumping becomes weak because the signal starts coming from everywhere. This can lead to lung congestion, as fluid back up in the alveoli are not able to up into the alveoli or the air sacs of the lungs. This fluid can cause a cough as the body tries to clear it out. There is in the lungs, there is a strong efforts going on to push that cough away. So there is a passage there is a place for the process of oxygenation and removal, purification of the blood. So due to the mucus there, congestion there is no space, and as a reflex of that, the mucus has to be pushed out. The body, the whole process is being taken. So the cough arises due to the heart failure. So another symptoms are a wet cough that produces sputum or a mucus and slightly pinkish in color. There is a wheezing or whistling sound You auscultate the patient. If you're suspecting heart failure, you auscultate shortness of the breath, very shortness of the breath, right from just raising the hands to walking few steps. They will be breathless. They will fall short of breath. Even at a lying down position, they will have breathlessness sometimes. So paroxysmal nocturnal dyspnea is another characteristic symptoms, bubbling feeling in the chest and the lungs, and a long-term dry cough. If not, if whatever they have taken treatment for, these are the symptoms. If you get in your clinic, these are the tips that the patient will be in the hypertrophy or cardiac failure. So don't ignore them. Take it seriously. So what was the learning from the cases? The exact observation, the exact collection of the exact symptoms, and understanding the individualization symptoms. This becomes the key in clinical practice. Okay, if you learn these tips, if even I learn these tips in each and every case, okay, no two cases we know all. We as an homeopath, we know that no two cases are alike. No two cases are alike. As I said, I have like last 1.5 months, we have 14 to 16 cases. None of them got the same or similar remedies. All are different. We learn from each and every case. We learn because homeopathic base is individualizing. If you individualize the case, okay. Now, since then till date, I am giving Digitalis 30 TDS every 15 days. She is much better. We have stopped her all medicines. Last time she was on immunosuppressant, which was 6 tablets a day, and we have stopped it last time. She was doing extremely well. Day before yesterday, she called me because I needed a consent to share the case because I'm showing her photo. So I asked her whether I can show your photo. Yes, she said yes, I'm fine, okay, absolutely no problem. And she shared with me that I'm much better, doctor. I've stopped the medicine because last follow-up immunosuppressant was stopped. She's doing good. Her O2 is managed. We keep a record of her blood pressure. We keep a record of her O2 levels. Okay, and regular checkups are going on. She's doing extremely well. The physician, we refer the case to him also. He is very happy for the case and he enjoys her visit. Such an excellent result with simple remedy and simple understanding. Okay. So any questions now? Which books are Allen's and Boric? I use Allen, Fatak, Boric. In very pathological cases, I use Kent repertory. We should be very sure about our how was her pulse rate as described in the same as I described. It was very slow when I examined, but she made some effort for changing her position and just immediately I checked it again. So as it is written in the book, it was. So about the pulse rate, yes. And after 4 doses of the follow-up, you saw the voice. She was much better. The hoarseness was better. Only 4 doses. Okay. Yeah. How to select potency? Potency depends upon, for me, in my practice, what I do is, the more the pathological symptoms, the more particular symptoms and lesser general symptoms, I go in lower potency. If partially the remedy is pathological and I have few general symptoms, I go for 200. And in 1M, so I don't remember I have given anybody in pathological cases if my prescription is. The lowest, the most better. Just before starting the webinar, I and Dr. Pravin had a talk. This I learned from Dr. Farooq Master, especially in kidney diseases, where we treat the interstitial pathology of the kidneys. We use 6, 9, 12 potencies, which give better results. I have not used such a lower one, but preferably I go for lower potency. Repetition for this case, Digitalis I did TDS for 2 days, SL for 15 days. LM in pathological cases, I don't have such an experience. Only in arthritis cases, where the pain on a daily basis and patient is taking painkillers, I use LM. But that my arthritis for this lady, I was giving Rustox 200, once AD2 BD and Rustox 0/4 twice a day on a daily basis. No, allopathic medicine were tapered because the physician, the chest physician is an excellent human being. So we know him very well. He does not give any unwanted medicine, undue medicine also. In my whole career, I've seen this chest physician reducing even immunosuppressant. So for me, it was easy. But I used to tell the patient, देखो ना डॉक्टर को पूछ के कि मैं कुछ ये मेडिसिन कम कर सकती हूँ, अभी तो मेरा बेटर है. Because we had a record. We asked them to keep a record of O2 levels and the activity they are doing, the BP thrice a day. So perfect monitoring, perfect guiding the patient to be perfect. Okay, when we allopaths don't give significance to such things in the clinics, right? See, when you get a patient admitted into a hospital, 3 times a day they check the blood pressure, 3 times a day check the pulse rate, 3 times a day they check the temperature. We have to learn from them. Okay, the clinical tips. There is no need, patient is stable, still the sister will come and do it. Ask the same thing, either you do it by yourself or train the patient to do by themselves. And when you have a perfect record, other physician also will respect you. Even other colleagues, the modern medicine colleagues will respect you for your such things, because they see what they are shown. If your blood pressure on the paper is perfect, they will not give extra medicine. This is, I have made a practice now. I myself teach them. I ask them to buy a digital blood pressure or whatever. If they want to buy normal thermometric blood pressure, I teach them. Take this, show this to your doctor. They will also have, nobody likes to give extra medicine and nobody likes to take extra medicine, whether allopathy, whether Ayurveda, whether homeopathy, nobody likes. So teach them, no? Our first job is to teach and then give the medicine. A known person, doctor means a known person. So for knowing, we have to learn and then we have to teach so that we learn perfectly. Yeah,
Yes, absolutely right.
Immunosuppressant were reduced. Last time when she came to me 10-12 days back, I reduced. On Friday, I called her, day before yesterday, Thursday. I called her to ask to take the consent. So she said कि मुझे अभी कोई तकलीफ नहीं है even after stopping. And it is not that we stopped it randomly. It was very systematic dose. Okay, she was taking steroid 3 times a day, 10 milligrams 3 times a day. Then we reduce it to 2 times a day. Then we reduce it to 1 time a day. Then we reduce it to alternate days. And after that, we asked her to take a chest physician's opinion. He said कि steroid में आधा alternate day का तो कुछ रोल ही नहीं है, बंद करके देखो क्या होता है. He wrote 2 cup syrup. We said कि don't buy, just see how to do it. So we managed it. There was no episode of cough and nothing. She did not buy. She was much better. After 15 days, again we asked her, go and visit the chest physician. I'm having no complaint. Can I reduce immunosuppressant? The doctor said कि तो इतना जल्दी तुमको क्या जल्दी ऊपर जाना है? Okay, then happily he said कि okay, you're taking 6 tablets. दोपहर का 2 बंद कर दो. We said okay, you reduce it once, 1 tablet 3 times a day. So TDS 3 tablets a day. It was 4. We did it 3. And then we took a follow-up of 1 month with all her vitals being checked regularly. And then gradually, देखो डॉक्टर मैंने कुछ दिन तक तो लिया, लेकिन उसके बाद एक गोली करके 3 टाइम लेती हूँ. See, this is my thing. Doctor was very happy. उसने कहा एक टाइम का और बंद कर दो. So the systematic way helps everybody. So you have to do it on a daily basis. And you have to repeat such results on a daily basis. Even I am learning. So this is thing which I do in my practice. Any other questions?
Yes, this is a question and answer time. If anybody have a question about 3 cases, you can ask. You can ask the questions regarding cases and this second wave. Dr. Shakil sir, you describe so nicely. You come to the point so precisely about in pathologic cases, you must need to go with the observation, exact symptoms, PQRS, and also consider the pathology along with the clinical observation understanding. Then and then you will get exact remedy. For this case of CCF, you come to the very good remedy, that is digital. It helps in cardiac asthma, CCF, congestive cardiac failure especially, and it is itself a heart remedy, right? So good. Yeah. Anyone have a question, or we have to conclude?
So even you can
Cactus.
think of cactus,
Yeah.
Grindelia robusta. Grindelia has a chain
Soften.
stroke respiration. Yeah, you have to read this chain stroke respiration. If you get chain stroke respiration and the symptoms of that, if you understand this, Grindelia is very easy remedy for you to prescribe. The patient will tell you the symptoms. Everybody I'm telling, trust me, patient will tell the symptoms and you no need to go for any other thing. No need to inquire also, but just understand the process. The last remedy, there are few more remedies, Trophanthus. These are the rare remedies. Okay, you can think of again Kalikab, as Dr. Pravin said. It's one of the potassiums are very prominent in respiratory and lung diseases. So they have affinities, even some natrums, and as other respiratory and asthmatic remedies also you can think of. So if any queries.
So just the input in this your case. Whenever there is a case of congestive cardiac failure or cardiac asthma, or especially the cardiomyopathy or cardiomegaly, and along with the asthma, I try to always go with the mother tinctures like Cratagas or Cubeva. Is also or Aspidosperma. It also helps to increase the cardiac action, and also helps to reduce the pulmonary hypertension in these cases, which helps to increase the oxygen level in the body. So no doubt, yeah, you have a very good, other options like Strophanthus, and along with the Digitalis, we can go like this way. So nice. Yeah. Any questions, Dr. Shakil? May I share my screen now?
Yeah, sure.
Yeah, please. So if you have a question, you can ask. There are almost 22 participants. You can ask your question if you have. So what is the conclusion? Okay, so we have seen 3 cases, right? See, every case is different. As Dr. Shakil told that what I can do, he cannot do. What he can do, that I cannot do. This is the you can say very typical characteristics of every individual, and that is the law of homeopathy, individualization. So there will not be 2 cases with same remedy. You can enter in the case with different areas. Okay, so it's not like I am doing something great. It's not like that, Dr. Shakil. You have your unique quality. I have my something special understanding to enter in the case. So this is the art of intellection from where we can understand the case, right? So
Yeah.
friends, this is I think yeah. So send your feedback, send your questions if you have, and you can share your thoughts. Okay, and on 12th and 13th of February, I will be there in my Thane clinic. You can send your patients or you can consult me there. So send your feedback on my email ID, pravin.pente@gmail.com. You can also WhatsApp me on 9011402676. It's a 76. Yes. So in future, we will be coming with more clinical cases. We will be coming with more interesting, lectures or the series which helps you in your clinical practice, which helps you to understand more pathological cases, more clinical cases, more short acute cases. Okay, so be with us and send your feedback. And thank you so much, Dr. Shakil, for being with us for this session. And hopefully, we'll be coming with more sessions with you and other homeopaths across the India, also across the globe. So stay tuned and be with us. Thank you so much. Thank you. Thank you so
Thank
much.
you everybody for peaceful
Yes.
listening and asking queries.
Yeah.
Learning a lot from you all. Thank you so much. Thanks, Dr. Pravin.
Yes. Yeah. So I think we have to end the session. Thank you.
Okay.
Yeah. Bye bye.